Hi everyone, Sarah McBride here. I'm the National Press Secretary at the Human Rights Campaign. We're really excited to have you join us for this Facebook Live conversation. Yesterday, HRC and Whitman-Walker, which is a nonprofit health center in Washington, D.C. with a special expertise in LGBTQ and HIV-related care, released Safer Sex for Trans Bodies, a guide for transgender and gender-expansive people and their partners on sexual health and information related to making sure we all can live full, complete, and healthy lives. I'm here with three wonderful individuals. First, I'll introduce Dr. Stacey Carbon, who's the Senior Manager of Behavioral Health at Whitman-Walker. Next, the fabulous Angel Smith, a transgender rights advocate and educator. And to my left, the amazing and wonderful Noelle Gordon, who's the HRC's Senior Program Specialist for HIV Prevention and Health Equity. I'm really, really excited to have this conversation. I have a couple of questions prepared for my co-panelists, but we also encourage you to ask questions. If you have anything that you want to know, feel free to write it in the comments section. Obviously, keep it safe for work. But we are happy to answer any questions as this conversation continues. I'm also really excited to have this conversation as a transgender person because so often transgender people are reduced just to our transness. We forget that transgender people have a sexuality, have a life outside of being trans that may include sexual partners and spouses. And so I'm really excited to start this conversation. And what I really want to start on is, what's the landscape right now for transgender sexual health? What's the reality on this topic and where the need for this resource, this guide, comes from? And Angel, maybe I'd start with you from a personal perspective.
From a personal perspective, I think that a lot of trans people come out really young. And in that coming out really young, we don't know exactly who or what to do to guarantee good health care. Like when I came out, I had a transgender friend that supplied me with hormones and all those things, which is difficult on your liver. Like you can't have hormone treatment or hormone therapy and you're not getting health care. So it is important for trans people to receive proper health care so they can take care of themselves on top of receiving hormone therapy.
I would say, from a clinical standpoint, what I love about this guide is that it's creating this counter-narrative. I think the dominant narrative has sex as something that's taboo, in the shadows, something we don't talk about. And this guide kind of just sheds light on that. And it talks about sex as a positive, pleasurable experience that can be empowering and fun. Really talks about boundaries, communication, and provides language. And I think, kind of riffing off what Angel said, we need to talk about these things. We need to not put it, hide it away and not talk about it. So that's sort of how I see it. Really is answering this need for our conversation.
That's a great point, and I want to move to Noelle, who can sort of speak to the need for this guide from an advocacy perspective. But what you both sort of talked about is it does seem to me as a transgender person that when I came out, there really wasn't any information. I went through sex ed classes in high school, but there was nothing that was particularly relevant to me after I came out. So Noelle, from an advocacy perspective, and I'm going to ask people to speak up as we talk, from an advocacy perspective, where does the need for this guide come from?
Yeah, I totally want to co-sign everything that the co-panelists said. I think, there is a desperate and urgent need for a resource like this, but not just a resource that talks about sex and sexuality and sexual health, but to your point, a guide that does it in a sex-positive and affirming way. For so long, people have been taught to be ashamed of their sex, their sexuality, their sexual health, and this guide, what we wanted to do was really confront that head-on, because there are a number of urgent challenges facing the transgender community. As I'm sure you all are aware, one issue that is near and dear to my heart and is a priority for HRC is the HIV and AIDS epidemic. We know from research that transgender women in certain communities have 49 times the odds of living with HIV than the general population. That's 49 times the odds, and we know a lot of that is because of stigma, discrimination, transphobia that many trans people encounter when they're going to get tested, when they're going to get treated, when they're going to get treated or tested for sexually transmitted infections other than HIV. And so one of the things that we really wanted to do with this guide is make sure that it broke down the issues in a very clear, accessible way, in an honest way, but that gave people the tools to overcome those challenges with their provider, with their partners, with their spouses, rather than be defeated by them.
So that's a great point, and I'd love to dive into maybe some of the barriers that transgender people face when it comes to their sexual health. Obviously, just actual information is one of them. But Stacey, could you talk a little bit more about what those barriers do look like on a day-to-day basis?
Yeah, absolutely. I think for the trans community, health doctors' offices, medical facilities, therapist offices haven't been safe places. They have not been safe places where people can get competent care, get affirming care. Oftentimes, those interactions can be discriminatory. There's the major study that says they had a sample size of about 6,500 people, and in that sample, I think the numbers, I pulled it up somewhere, are that there were 50% of the sample postponed medical care, either when they were sick or injured, or preventative medical care, because of an inability to afford care. So we have there's this lack of access because of a lot of reasons, but then when people can access the care, they're not getting competent care. I think that also this great statistic that 20% of the sample size was refused care due to their gender status. And the one that always gets me was 2%, which was a pretty big number of people in the sample, were actually physically attacked in a medical setting.
Wow.
So when we're talking about this stuff, we're really talking about fear and the lack of access. So those are the two, I think, the major barriers we've got.
What do you think are, and Noelle, you might have thoughts on this, and Angel, what do you think are some steps that we can take as the public to address those barriers?
Well, one thing that I do as an ally to the trans community, or someone who aspires to be an ally to the trans community, is when I go into any facility, particularly a healthcare facility, if I see that there's no place for someone to put down their preferred name, or to put down the pronouns that they use, that's immediately a red flag to me. Because I've learned through conversations with folks like Sarah and others, the importance of having space and making space for folks to identify themselves, for themselves, and to have people use the language that they want used for them. And so if I go into a medical facility and I see that there's not a space for trans people or anyone to sort of identify themselves in terms of their name, their pronouns, I'm going to call the stink about it. I'm going to demand that someone tell me why that's not the case, because it's a simple fix. And I think that also translates to sort of bedside manner, quote unquote. When you're interacting with someone, are you using the terms that they want to use, or are you making assumptions about who they are, who they have sex with, based on what you see in front of you? And so those are ways that I try to combat really what is transphobia in many cases, on an individual level through conversations, but also at an institutional level trying to affect policies.
Any thoughts?
Well, I try to encourage my trans friends to go to Whitman-Walker. That's the most comfortable, for me, because in my experience going to doctor's office or hospitals, if they don't know your gender, then they're asking you questions that are uncomfortable. When's the last time you've been pregnant? Have you ever had an abortion? Are you on your period? And I'm looking like, well, I'm trans. So, and then once you tell them you're trans, you can see the uncomfortableness sometimes. I don't want to go to the doctor's office and be uncomfortable. I'm here for my health,
I think that's a really, really, really good point, because a lot of people sort of boil down this conversation around trans health, transgender sexual health, to sort of policies and specific, unique programs or services that we need. But so much of it is that even if we're just trying to get the basic care that everyone needs, we're scared. And for me, I'm sort of reminded of my late partner, who struggled with cancer, who while getting treatment for cancer, every single time he had a new doctor or he had a new nurse, he worried about coming out as trans to them. And you're already dealing with enough emotionally and physically and health-wise when you're just trying to live, let alone struggling with something like cancer, that trans people then have on top of that this constant voice in the back of their minds of, oh, this might mean that I'm not going to get the same care that everyone's going to get, or this provider might not even want to touch me, right? We know that happens a lot. And so, you know, I think that that's a really, really great point. Moving back to the resource in the guide, I'm curious, there's a lot of different things in the guide. And there are things that I learned as a transgender that I didn't even know before. There are terms that I didn't know. But that's important, right? Like, we're all on a journey, we're all still learning, and it's so important that when we're with other people, particularly in such a vulnerable setting, that we respect and affirm them. I'm curious what were maybe your favorite sections or topics in the guide, the things that you think are going to be the most helpful.
Definitely condom practices outside of condoms, but still, because you know, a lot of people know to use condoms, but a lot of people don't also know that it's certain ways to protect yourself doing other things. You know, like, so I found that very, very useful and very relevant. Because it's like, oh, well, I didn't know I had to use a latex glove, you know, for this, or, you know. So I found that very, very useful.
What about you, Stacey, as a provider? What are some of the things that you hear the most from either trans or gender expansive people or their partners that you think they might find most helpful in this guide?
Yeah, I think one of the best things the guide does is it just encourages conversation and communication. So we kind of set forth these 3 key points, right? So boundaries, I think it's what turns you on, and consent. So those are 3 pieces, and I think the boundaries really kind of hits it all, of having a conversation about what do you like, what do you not like, what feels good, what are no-go zones, we call it in the guide, no-go zones, what makes you feel safe and what makes you feel not safe. And so really empowering people to have those conversations instead of making assumptions or judgments. So I think the boundary piece, the communication piece, and then providing language of really saying, you know, this is how it feels when you touch me in this way, and encouraging people to share those feelings.
Noelle, as someone who worked on the drafting of this document, what are some of the main takeaways you'd want people to take away from reading this guide? What are some of the main points?
Well, I think, you know, one of the things that we wanted to convey, both HRC and Whitman-Walker and all the organizations who consulted on the guide, was to sort of say in so many words that trans people deserve, you know, the same information that non-transgender people have access to. They deserve credible, accurate, accessible information about their bodies in the same ways that non-transgender people currently get. And to deprive people of that is wrong. And so we really wanted to make sure that we were doing a service to not just trans people, but also to the partners of trans people, because as someone who is not transgender but has had the privilege of having many transgender friends and advocates sort of take me under their wing, so to speak, and sort of educate me, they didn't have to do that, right? And so as a secondary audience or a secondary purpose, we really wanted to provide a resource that would enable non-transgender people to not put the burden on trans people to educate them about their bodies, right? We now have a resource that any non-transgender person or cisgender person can pick up and learn for themselves, and then engage in conversation and dialogue with trans folk, versus the other way around, which often happens, which is, I have a bunch of questions, let me pull my trans friend to the side, ask them about their bodies or their transition or their, you know, parts, and then go do the research, right? And so I think often we get it in reverse, and so I think those are the 2 big takeaways. One, that, you know, trans people deserve this information and it's been long denied to them. And 2, that the sort of partners of trans people, cis especially, this can be a resource to you too. You know, this isn't just for trans people, but it certainly is primarily for you all and for them, for the community.
So what's next, sort of in the pipeline between Whitman-Walker and HRC with this guide and getting this information out there?
Well, first is rest, because it was a Herculean task, but one sort of a labor of love, if you will. The 2 big things that we're really looking forward to, first is taking the guide and debuting it at the United States Conference on AIDS, which is happening in a few weeks. It's the largest national convening of HIV and AIDS advocates in the country and sexual health advocates in the country. And so we really want to make sure this information gets out to the people who need it most, people living in the U.S. South, people living in other countries who come to the U.S. to learn about the ways that we're handling our epidemic. And so we're really going to start to take it from conference to conference to make sure that it gets in the hands of people who need it. The second thing that we want to do is ensure that it's accessible to people of multiple languages. And so the first language we're going to translate it into is Spanish, since we know there's a large HIV burden among trans Latina women and trans people who identify as Latino generally. And so making sure that the guide is accessible in Spanish, and that will be happening by the end of the year, and then that will happen, or be available rather, on hrc.org/HIV.
So Michael on the Facebook Live thread said a huge part of this problem is a lack of visibility. That lack of visibility has fostered fear of the unknown or the different. Education is an important component of increasing visibility. And I think that raises a good point, and it sort of touches on some things that we've touched on, which is this stigma around this topic in general. What are some ways that we can address that stigma? Not just in the context of sexual health, but more broadly. Amber, what are your thoughts? And if folks could speak loudly, I think maybe some folks are having difficulty hearing.
I think that what people don't realize is that sex starts as a conversation. Like, that's the prelude. You know, so you don't want to just jump in the sack with someone and you know nothing about them. They don't understand your body. You know, my boyfriend is cisgender, and I'm his first trans woman. So breaking the ice with him and explaining these things to him is important because he has to know how my body works for me to be pleasured. You understand what I'm saying?
Well, and I think that also brings up something in my mind, which is that, and one of the things that's great about this guide is it's not just for trans people and gender-expansive people, it's also for our partners, too. Mm-hmm. And part of this stigma is that people who date us, who love us, are sometimes afraid to say it publicly, to say it out loud. And so one of the things in my mind that we need to see more of is a conversation about it's okay to love a transgender person. And trans is beautiful, and that transgender people are worthy of being loved and being respected and being affirmed in who they are. And there's nothing wrong with that. And so that's, I think, part of it, too. Do you two have any thoughts?
Absolutely. I wholeheartedly agree. And I think, you know, something when we were working on the creation of it was really to include, I love that the language it's about our bodies and how we feel and our partners. And so it comes from this, it comes from a knowledge base where we're saying that trans people are experts of their own bodies. Some clinician, some medical provider, they're not going to necessarily be the expert in the way that someone is of their own body, their own parts, their own life, who they love, things like that. So I think, you know, having personal narratives like Angel's and telling stories, like we're only going to learn from the community. So this idea of an expert or a specialist, while those are, you know, great ideas, in this context, we need to hear narrative.
You know, I think for me, there's also a role for calling out stigmatizing behavior and language when I hear it. And so, again, as someone who is not transgender, who identifies as cisgender, you know, it's important for me to call out stigmatizing, as I said, behavior and language no matter where it happens, right? So whether it's happening in a doctor's office, whether it's happening in an educational setting, whether it's happening at work, whether it's happening even in my own home. If I have the ability, if I feel safe enough to confront that, I sort of have the sort of, in my mind, responsibility to do that, because there may be a trans person in that room who may be feeling scared, alone, isolated, and in that moment may be looking for someone, because there are definitely moments where I have heard something racist said, and I was looking to someone to stand up and speak out, and so I know how sort of paralyzing and isolating that can be. And so I think one way to sort of confront stigma is to call it out directly, and not in a way that I think alienates people. I think we want to sort of create teachable moments, give people the opportunity to check in with them and sort of educate them on how they can do better, right? So it's not, oh, you use this word, you're an awful person. Rather, this is the impact of that word on real people. And this is how they hurt when you say that word, and here are some alternatives.
I want to say something about that. I think that trans people have to learn how to advocate for themselves. Mm-hmm. Like Stacey said, we are the teachers. Mm-hmm. That's going to help remove that stigma. If we start talking to people, we can't be afraid to tell them how we feel, what makes us comfortable, what makes us uncomfortable. So we definitely can't be afraid to speak up.
And I think it's also important for cis people, cisgender people, to follow the lead of trans folks, right? And to not sort of supplement their own expertise or their own assumptions or their own opinions. Oh, I know what's best for this trans person, and I imagine that often happens in provider interactions. Sort of a medical provider will assume, well, I'm the doctor here, so I necessarily know what's best for you. And one of the things I think we're trying to disrupt sort of is the idea that, well, maybe this is sort of be more of a dialogue or a conversation rather than sort of a one-way, top-down sort of situation.
Yeah, on that note, so at Whitman-Walker, we've really embraced this idea of cultural humility. So we've sort of taken this idea of cultural competence and tucked it away a little and talking about humility. So as an institution, understanding how this is a lifelong learning process. This isn't about, one training that we take and now we're experts. And part of that is understanding that everyone expresses identity and expresses gender differently. And so for our medical providers, for our client services folks, for our therapists, really we're taking out this idea of pathology, of something's wrong. I often say, what's going right? And people look at me like, you're not supposed to ask me that. You're supposed to ask me what's not going right. It's like, it's all important. So back to the notion of cultural humility. So at Whitman-Walker, we're a feedback culture. We learn from what we've done right, of our strengths, but we also think about what we haven't done right, what we could do better. So I've been with a colleague working on Trans 201, we're calling it. So it's with our providers looking at patient experiences and saying, what's the issue? What did the client feel? What could we have done differently, and what were the lessons learned? And we're taking these scenarios and basically saying, like, what happened here? How can we do it better next time? And I love it because it puts also story in the room of first person. I walked into the clinic, and this is what happened, and I felt like this. And so I think that's how we learn. We open up the doors to say this is a lifelong learning process, and no provider's going to tell me how to, use my body or what transition may look like.
So Whitman-Walker is accepting new patients?
Or come on over.
Okay.
Down the street.
Great.
I also want to make another point that if folks are interested in seeing the guide, it is available at hrc.im/FBLive. So you can find the guide there, download it, read it. You don't have to be trans or even dating a trans person for this to be relevant for you. This is helpful for anyone. Like I said, I learned new things from this guide. We had one question on the Facebook Live feed, and again, a reminder, folks, feel free to ask questions. We're taking them and asking them here. One commenter asked why treatment as prevention wasn't included in the guide, and what your thoughts are on that, because I know we do a lot of work on treatment as prevention.
Yeah, definitely. I think one thing that we really try to do with this guide is use language that sort of resonates with people. And so while we may not use the term treatment as prevention, which is a very technical term, I think that information is there either explicitly through the guide and implicitly through the other resources that we refer to, right? So no one guide is able, I think, to or should try to encapsulate all the information that's there, right? But I think a really good guide, and thing that we try to do is provide a foundation of information and then refer to people who have even more information, and that can be found in the back of the resource guide. And just so folks are aware, treatment as prevention is the idea, backed up by evidence, lots of it actually, that people living with HIV who consistently take their medication, by most counts for at least 6 months, who achieve an undetectable viral load, which means that a standard HIV test cannot detect HIV in the body, is virtually it's impossible for a person living with HIV to transmit the virus to a partner if they are undetectable, if they've been consistently taking their medication. And it stresses the need to ensure that people living with HIV, especially transgender people living with HIV, have access to the medication they need first to keep themselves healthy, and then second, sort of, not transmit the virus onto their partner. And so, in short, that information, I think, is available in the guide, although it may not be referred to as treatment and prevention. Like I said, in the guide and also through the resources that exist. And in future iterations, that's something that I think we'll be building out as the science around HIV sort of changes, as it seems to change by the day and by the month.
I want to broaden the conversation a little bit, because I think one of the things that is so important in a conversation about transgender sexual health and just sexual health in general is that sexual health is a component of a broader, comprehensive approach to living a healthy life, and it's an integral part, but it's also one part. And there are so many challenges, as we've sort of touched on, and Angel, I think you brought this up in the beginning really well. There are so many challenges and barriers that transgender people face to obtaining the care they need throughout healthcare settings, not just as it relates to their sexual health, but as it relates to their overall health, as it relates to their ability to transition. So I'm wondering if folks can talk a little bit about some of the barriers transgender people continue to face in this country when it comes to healthcare in general. I know we've talked a little bit about this, but let's dive into that a little bit more. Stacey, do you have any thoughts?
Yeah, I mean, I can definitely say something I've been very active on has been working with people to get gender-affirming care, but specifically gender-affirming surgery. So, historically, mental health providers have been in this role of kind of gatekeepers, and people come in, with this expectation that I am there to say, yes or no, that. And so I think, one of these barriers is still this notion of gatekeeping. And, I often say, these are the standards of care that your insurance company and your surgeon are going to require of us, so here we are doing this. Continuing to work on policies, continuing to work with insurance companies, getting coverage, that's a big thing. Luckily here in DC, there's access to care, which is wonderful. But you go, one state over, it's very different. And, we see people who will come from hours upon hours away to come to one medical appointment. So I think, access to competent care, access to the care that people choose for their own bodies, those are really the biggest barriers right now.
Angel, what do you see as some of the biggest barriers to transgender people getting affirming, life-saving care?
I think misgendering is an issue. I think that even if trans people don't necessarily have their names changed or whatever, that they should take the lead to tell the person that this is who I am, this is what I prefer to call, and it shouldn't be so tough for doctors to do so. You have to respect the presentation.
Noelle, as an advocate, what do you see as some of the biggest barriers?
Yeah, so I tend to think structurally, and I think there's been lots of really great conversation about individual barriers, which structural barriers reinforce individual barriers, and individual barriers reinforce structural barriers. So definitely think there's a relationship between the two. I think you can't talk about sort of the transgender community without talking about, unfortunately, sort of the levels of poverty that exist among transgender people. There are tons of surveys, including the National Transgender Discrimination Survey that the National Center for Transgender Equality does, that makes very clear that transgender people live in poverty levels that far exceed sort of the general population. I think there are some data that demonstrate that some people make less than $10,000 a year just to survive or subsist. And thinking about the cost of healthcare, if you're trying to make decisions about whether you're going to pay your rent versus pay food versus pay for your son or daughter's tuition bill versus pay for an HIV prevention pill, your more basic needs are probably going to shine through. I think any person would do that. And the even sadder reality is that much of the reason why transgender people are in poverty has to do, again, with the fact that they face stigma and discrimination from employers. And so that's why it's really important, I think, to the point that you made earlier, Sarah, for us to think broadly about health. So what does it mean to live in a state that hasn't expanded Medicaid, for example, so you have increased access, and doesn't have protections against discrimination, right? And so you don't have protections against discrimination, so you're fired from your job for being trans. That was the only way that you had access to health insurance. That was the way you were paying for your hormone replacement therapy. That was the way that you were paying for your HIV prevention pill prep. That was the way that you were paying for your diabetes medication. All of that goes out the window simply because your employer didn't like the fact that you were trans. And now you have no other options. And so that's why it's really important, I think, for us to place these health issues in a much larger macro sense, and for us to be providing people with the tools, to your point, Angel, to be able to advocate for themselves.
Well, and speaking about those structural issues, and we've seen some progress on this at the federal level, a lot of transgender people face categorical exclusions in their insurance plans that forbid any kind of medically necessary care that would be utilized to help an individual transition. So hormone therapy, surgeries, and this is despite the fact that the AMA, the APA, all of the major medical associations have deemed this care medically necessary. We still have these categorical, blatantly discriminatory exclusions in a lot of plans. And I think one thing that people don't realize is that sometimes those categorical exclusions don't just apply in practice to the medically necessary transition-related care, but one story that really sticks out to me was a story I heard from a transgender friend who, and fortunately this situation was resolved, but she was a transgender woman. She was playing on an all-women's softball team, and over the course of a game, she broke her arm. And the insurance company denied coverage for the care of her broken arm because they said this falls under the categorical exclusion because if you weren't trans, you wouldn't be in an all-women's softball game, and therefore the resulting injury was a byproduct of you being trans, and therefore is in our category covered or excluded under our exclusion. And so, I mean, just absurd stories that people have to face sometimes. And so that's a big structural barrier that's written into almost, at least a year ago, almost every single insurance plan in this country in a lot of states. Fortunately, we're seeing some progress at the federal level, although there are challenges to make sure that transgender people can access the care they need, including hormone replacement therapy and surgery. Amber, I'm curious your thoughts on that topic.
I think that, of course,
That's okay. Stacey, if you have any thoughts on it too, as a provider.
Let's see. So, I think Angel spoke earlier about fear, and I think what a lot of people fear is that they're not going to be able to get the care that they need, and I think that's at the end of the day what it comes down to. I've had the amazing opportunity to work with Angel in working to educate our clinicians, working to make our environment at the clinic a really positive place. But ultimately, it's if you can't come and get the services there, then that's for naught. So I think, like you were talking, this macro levels or systemic level, the change is needed.
I may have said Amber. I'm sorry if I said Amber. One commenter mentioned this: trans people are denied care. Trans people are forced to pay out of pocket for things others have covered on insurance, and I think that sort of highlights the sort of tangible impact of that discrimination, right? I mean, one hand, it's that you can't be yourself. The other hand, it's if you still try to be yourself, it can cost thousands and tens of thousands of dollars to be able to live the identity you are. And I think that's unfathomable to a lot of people. And then to your point, Angel, that you made at the beginning, people then resort to the black market, which poses significant health problems in and of itself. So I don't know if folks want to touch on that a little bit more.
Well, if you don't feel comfortable in a health setting, what choice do you have? You have friends that have this and that have that. Of course, they're not doctors, so you're not getting complete overall health care, but it creates a area where you further destroying your health overall. Because if you taking bootleg hormones and you're not taking them correctly, it affects your liver, it affects your kidneys. Transgender people who take estrogen have a higher risk for blood clots. So you have to be careful of all these things. And then if you're not able to get these gender reaffirming surgeries, they do stuff like silicone injection, which is dangerous and extreme. And then you're what's it called, free injecting. So but these are things that we feel we have to do to look how we feel.
Well, and I think that that's something that people don't understand, that it can cause real pain when you aren't seen as the person you know you are, right? And it is such a demoralizing and disempowering and dangerous experience to live that. And I love everything you just said, Angel, and I think it's so poignant. And I think it's also, though, worth in this conversation pointing out that not all trans people do want to pursue transition-related care. Some can't have hormones for medical reasons. Some decide that they don't need hormones to be themselves. Others, same thing for surgery. And so I think it's important to certainly acknowledge that nuance in trans identities when trying to access care. Noelle, we talked a little bit about some steps that people can take to address the barriers that trans folks face in sexual health. To close, what are some steps we can take to make sure that our healthcare settings are affirming and safe for trans people across the board?
Well, first, I would tell people to not underestimate the power that they have as individual advocates. To sort of signal boost what Angel said earlier, and to go into a clinic and sort of to demand the care that you are entitled to, right? Your dollars are just as green as everybody else. Your insurance is just as good as everybody else. And so to be your own advocate and to utilize resources like this guide to help you open that conversation. So if you don't know how to talk to a provider who's not giving you the care that you need, but maybe you want to give them the opportunity to do that, you can use this guide to be like, hey, can I leave this here for you? You maybe read it over, and we do a follow-up appointment around some questions I have around PrEP or about treatment as prevention or about hormones, right? That's one concrete thing that people can do, right? Not underestimate the power of themselves to be advocates. The other thing I tell people to do is to report, right? Report instances of discrimination, report instances of harassment to the Employment Equal Opportunity Commission, to any and everyone that you can speak to, because despite sort of the legal challenges, there are some new, existing, and emerging protections for trans people that one can avail themselves of through Obamacare and other things that sort of ensure, or are supposed to ensure, that transgender people and gender-expansive people get the care that they are entitled to.
And I want to wrap up on that point. That is a great point. The Obama administration this year issued regulations that ban discrimination based on gender identity in healthcare settings, in any healthcare setting that receives federal funding, including health insurance programs. So there is an incredibly important, vital layer of protection at the U.S. Department of Health and Human Services that transgender people can access if they do face discrimination. I want to thank you three for joining us. I think this has been a really, really interesting conversation. I hope you've enjoyed it. Thank you so much for your questions and for tuning in. And be sure to check out Safer Sex for Trans Bodies on hrc.org.